just had, I don't know why I'm getting all these sounds, but I think that's the YouTube. That's why. Okay, cool. We're live. Um, Good morning, everyone, and welcome to AI Philly's weekly COVID-19 crisis and response conference call. My name is Brother Omawale, the host of today's call. I'm one of the members of AI Philly's crisis and response team. So just to kick things off, I want to get things started with our AI Philly daily prayer. So if you just bear with me, I'll get started right now. O Amen Ra, Mother who feeds us, Father who protects us, you watch upon the creation, you are the creation. O Amen Ra, your breath is the pulse of the cosmos, your shadow covers the universe, from east to west, from north to south. O Amen Ra, my heart is humble before your majesty. O Amen Ra, protect all of us, we are mortal and fallible. Remove from our path all obstacles, and protect us from illness, meanness, greed, and envy. O you noble spirits, you watch upon the creation, you are the creation. We feel your presence in air, water, fire, earth. We can hear you in the thunder and the ocean's waves. Your brilliance is that of the stars in the midnight sky. Your radiance is that of the sun in the noon sky. O you noble ancestors, you watch upon the creation, you are the creation. Our blood is your blood, our flesh is your flesh. Look after us, we implore you. Some did not wake up this morning, some will not go to bed tonight. Keep us alive, keep us healthy, protect our children and their children, protect our wives and husbands, protect our neighbors and friends, protect Africa, which needs it so much. Protect us who testified today about your greatness. Protect us, we who keep shrines dedicated to you and your glory. O you noble ancestors, the day is long, the night is long, and the opportunities to betray Ma'at are numerous and constant. Allow our heart to be inundated with Ma'atic thoughts. Allow that from our mouth only comes Ma'at and Ma'at only. Give us the courage and the strength, the integrity and the determination to fight for a better world, for an Africa that is united, strong, and free, for brothers and sisters who do not feel inferior anymore. Remind us all the time that it is better to die standing up than to live on our knees. O you noble ancestors, like you, we wish through our actions on earth and this life that you gave us to earn eternal life. Keep us on the path of Ma'at. Help us defeat Esfet, so that our children and our children's children call upon our names. Remind us night and day, whether we are asleep or awake, that unity is our aim and victory is our destiny. Ashe, Ashe, Asheo. All right, family. So just a quick reminder, the purpose of this call is an opportunity for us as members and the broader AI Philly network and family just to check in with us on a weekly basis while we are not meeting in person during this, I guess, extended social distancing guidelines that are happening in our state and in our local areas. So really, we want our members to work with us just to stay connected. Also to let us know if they have any health concerns related to COVID-19 or any health concerns that we need to know as a community so that we can support one another. Also, if you have any essential resource concerns such as food and or medicine shortages, this is an opportunity to let us know so that we can galvanize the resources that we have to assist one another. And last but not least, this call is meant to provide any vital COVID-19 updates. As we know, things are changing here on a day by day, week by week basis. And we want to make sure that our members are kept up to date with uh, critical but also verifiable information. There's a lot of gossip, there's a lot of rumor out there. So we want to kind of sort through that for you and filter the bad stuff out and only give you those things that are critical to your health, your safety, and your well-being. So that being said, I am going to allow my fellow members on the crisis response team to unmute and introduce themselves. So we'll start with Sister Kizzy, who will give us a macro, update on the environment. Then Sister Tata will speak from a wellness perspective. Brother Maurice will speak from a safety perspective. Sister Wawa will discuss communications, and I'll give some brief updates on our programming. So that being said, I am going to mute my line, and Sister Kizzy, you can unmute and do your thing.
What's up? Good morning, greetings, world. Um, so I'm just gonna take it from the top, give us the numbers, and then run through a couple of talking points. As of yesterday afternoon, Philadelphia, the city, has tested well over 40,000 people. Of those 40,000 people, we have 12,329 positive cases, and 484 deaths. Over half of those deaths have occurred in those congregate settings, long-term care facilities for the most part. Um, and then, of course, you have other outliers in different places and regions, but the majority of the deaths that we're seeing in the city are coming from those long-term care facilities. So last week, I spoke a little bit about that whole idea of getting over the hump, getting over the peak, watching the new cases as an indicator to see how much impact we as a city are making in slowing down the rate of transmission. Although that number fluctuates for a myriad of reasons, there is some reason to be a little bit optimistic about how we're transitioning through the care and maintenance of this virus in our city. If you pay attention to sort of the overall average number of new cases over the last week, there is what seems to be the beginning of a decline. However, we're not anywhere near out of the woods yet. Um, the next phase for Philadelphia and really as a nation is going to be this widespread rollout of testing and hopefully over time contact tracing. The testing piece, I'll speak to a little bit more towards the end, but it's going to be interesting and a little tricky to me. But I'll talk about that more in a second. What I do know is that contact tracing efforts likely won't begin until we start to hear 50 to 60 new cases a day. So, what that projection looks like for at least Philadelphia is potentially in the next 6 to 8 weeks, we could get down to that number. Um, and so that's kind of like one of the points of concern that I wanted to talk about just a little bit, um, was around the contact tracing piece. Because frankly, what that requires in order to work is a certain level of trust. This is a government entity that's calling people, asking, where do you work? How many people did you encounter within a certain time period before you got sick and or diagnosed and just after? They're going to potentially ask you identifying information about people who live in your home if they've gotten sick. What are their first and last names? Who they have or haven't been around, and if those individuals have gotten sick. Basically, what this does is allow different health departments and other entities that are working on trying to eradicate this thing to really zero in on how quickly the virus is moving, but also like what the rate of infection is from person to person. Again, keep in mind, we live in a city of 1.5 million people, and we've only just scratched the surface in testing a little over 40,000, which I think comes out to like 1,500 people a day. Um, the reason why I bring this up and, hearing the information about how this virus is disproportionately affecting our communities is again the valid and deep rooted medical mistrust that runs through our communities is very real. And I can see now, people calling, requesting this information, people not feeling comfortable, people not wanting to get that information for whatever reason. And all that's going to do is more harm than good, particularly for our communities if we can't see what the rate of infection is in our communities. People want granular race-based data, and this is one of the ways to get it. So if you or someone you know has tested positive and you receive a phone call, or you've been hearing that other people have been receiving phone calls, or whatever the case may be from the health department, and they are asking you questions and they let you know, this is a part of an effort to sort of reduce the spread. We just want to add very limited information. These are things that are kind of sort of already out there in terms of hospital records and things like that. So it's not like we're digging and searching for information to just pull on you. These are reports directly from the hospital or wherever it was that you got tested at. We just want to verify that that information is correct. make sure we have an understanding of whether or not you've been self-quarantining since you got the test, or if you had to go to work the next day, and where you went to work and what those things are, because all that does again is help us understand how quickly this virus moves from person to person and how it's moving in specific communities. To the testing piece, on a national level, it seems like the idea of widespread testing efforts are being left in the hands of the state, um, which carries with it the possibility of gross injustice and potentially a bigger issue on our hands, depending on what state you live in. I think that Pennsylvania sort of falls somewhere within the median space. Um, I I don't I think the governor is doing the best that he can to try to figure out what is the plan in order to get businesses and people back and moving and active. Um, I don't know what that looks like, because what it sounds like is that how relational you are to other spaces in government, to leadership on a national level in government, and just who you know on a global basis can really affect how your state is impacted by this. I say that to say my family is in Maryland. Governor Hogan was able to acquire 500,000 tests overnight through a connection that his wife had because he couldn't get support from national leadership. I don't know who Tom Wolf knows. So that that's kind of like an up in the air thing, but I do feel okay in terms of how our state is trying to move through these things. But for example, my cousins who live in Georgia, that's a completely different conversation. Or, an aunt and uncle who live in Texas. There are a lot of different things that are happening, and leaving the widespread testing up to a state level, um, I think is definitely going to continue to show and unearth the ugliness that exists within this country and how we engage and relate to healthcare. Um, so I'll try to be more intentional as we move forward on this call and keeping up to date with what different states are doing and report that information out as well. And think through how Pennsylvania seems to be moving and what that widespread test out rollout could look like for us. The last point I just wanted to make quickly, I know last week I asked Brother Maurice about what if the city had any plan to support individuals who were released from jails, and they didn't have anywhere to go. If they couldn't go home and they couldn't go to a halfway house, where would they go? And so I learned yesterday that the city is indeed working on efforts to try to house some of these individuals at the hotels that are currently being used to house the shelter populations and elder populations that don't have anywhere else to be. So nothing has been confirmed to my knowledge, but it seems like the city is also working on trying to place these individuals in those spaces as well. And that's all I got.
Okay, thank you so much, Sister Kizzy. Just two really quick questions for you. One, have we seen any updates and the different symptoms? Like I've seen articles that have referenced the CDC saying that they're pointing to some additional symptoms than the original, combination of like fever and the other 10 things that they were tracking. So I guess at your level, has there been any additional symptoms added that we should be watching out for?
Sure. So one of the things that I know that people are taking into account now, and that was highly reported early on, but not really sort of seen as something to be worried about, was a loss of taste and a loss of smell. Um, those are sort of the top two ones that come to mind just off, as soon as you ask me the question, but I feel like there might be one or two more. I may be able to get back to you at the end of the call with that if there are additional.
Okay, all right. And I know you said that it's looking like things may be like 6 to 8 weeks out in terms of when we get to that 50 to 60 new cases per day level. But from where we stand right now, has there been any guidance or talk at the local and or state level about what a limited, opening up the state might look like and the timeline for that? Because I think I heard something like May the 8th, but like I said, there's a lot of rumors and gossip out there. So I want the real version from those who may know.
Sure. Philadelphia is not opening back up on May 8th.
Okay,
I can tell you that right now.
gotcha.
What the state has sort of put into place is like a a stoplight system, red light, green light, yellow light. So red is sort of like the maximum protection tier, which I guess you could call where we are now. This is, only essential businesses, essential workers are out and about, maintain all of the guidelines, et cetera, et cetera. Yellow light will likely begin to happen in some of the more rural areas of the state. Again, because they're rural, they're kind of sort of already socially distanced and rolling out small openings of businesses and things like that. Philadelphia is really honestly in the green light phase because it's such a dense city. People literally live on top of each other in this
Mm.
city. So to just release everyone all at once is only going to increase the spread. You even saw it in Wisconsin after they had people standing in line trying to vote. They saw a spike in cases, thinking that there wasn't going to be an issue as long as people had face masks and were separated. Not how it works. If you don't have to be out, don't be out. Um, so I would say Philadelphia is definitely probably the last on the list in the state to be thinking about getting reopened. There may be at some point, I feel like I heard the mayor talk about some kind of military flyover thing that's supposed to be happening, and encouraging people to like, oh, get outside and walk around and whatever. If people do that, even as the weather begins to break, remember to keep your distance. This seems to be something that people are particularly struggling with in cities is just because you have the go ahead to wear a face mask in a store or whatever, it does not mean you still need to be on top of me in line. It does not mean that you should feel emboldened to walk past me or brush past me in an aisle. Like, you can't see it. We don't know what the infection rate is. You have to be overtly conscientious of how you're moving and how you move around people. And so, yeah, we're definitely as a city last on the list to begin to open up, but Tom Wolf does have a plan that's out, and I think you can find that on the state website, pa.state.gov or something like that. That he has outlined. It's like a nice little infographic that says exactly what it looks like for residents and businesses at each level of the red, yellow, and green light tiers.
Okay, thank you so much, Sister Kizzy. Sister Wawa on the communications end, maybe if we can find that, and when we send out the playback, if we can send that with it, that will be helpful. All right. Thank you so much, Sister Kizzy. Sister Tata, you can unmute your mic and you can provide your update. Thank you.
Hotep, thanks, Brother Omawali. Today's health spot will focus on mental health. It's something that's extremely important and it's not always talked about in our community. So, what I really want to do is just offer some self care tips focusing on us connecting with the elements to help us alleviate any depression, anxiety, or troubled thoughts that the community may be experiencing during this lockdown. And especially since the weather is starting to get a little better, then there are opportunities for us to be outside and to just take advantage of what nature has to offer us. And also, these particular three main areas that I will mention, there's been recent research associated with them that just helps mental health overall, as well as COVID-19 and keeping us safe during this time. So, the first one I'll mention is sunlight. As we know, sunlight is extremely important. So, other than it stimulating the production of vitamin D, it actually increases serotonin. And the exposure to sun can help us reduce anxiety and depression. And researchers recently found that the sunlight actually energizes our T cells, which fight against infection. So, of course, that is something that is extremely important to keep us safe during COVID-19. The second main piece I want to talk about is exercise. Exercise has a profound impact on depression and anxiety and relieving stress. It's just important to get up and move about if you do find yourself sinking into any of those particular feelings, as well as regular exercise helps you sleep better and boost your overall mood. But more recently, researchers have found that endurance exercises such as running, brisk walking, and jumping around actually protect our muscles, and it produces an antioxidant in the body that defends against COVID-19. Last piece that I'll mention, which is something that may not be widely known, studies have shown that soil actually contains microbes that are a natural antidepressant. So it has a similar effect on the brain as Prozac, of course, without the side effects. And the reason behind it is the bacterium stimulates the production of serotonin, which makes you relaxed and happier. So those are just three areas that are maybe new to people if you didn't particularly know the connection between the sunlight, exercise, and um, the soil with mental health. That's a good association. And then especially the pieces relating to COVID-19. But also just a reminder that you can't pour from an empty cup. So it's important to seek support if you do feel as though you're suffering from any particular mental health challenges during this time. We all have families, and a lot of times we're doing things for other people, but we have to make sure that first and foremost we take care of ourselves before we can even bear to help anyone else. Thank you. That's all I have for you today.
That's a really good update. So you mean to tell me that if I get outside in the garden with my kids and play around in the soil, I'm getting sun and soil, the two S's that'll help me build up some antioxidants to fight this thing?
Absolutely. You can literally play in dirt.
All right, I'm gonna go get dirty today. All right. So thank you so much for that update, Sister Tata. Brother Maurice, you can go ahead and unmute your mic and provide your update.
Hotep, everyone. I just want to reiterate some things I had discussed in previous updates. Since we're now extended at home, I want to talk about some of the things that we kind of need to know and go over every so often. And that's pretty much us being a target on the cyber world. So just want to go over a couple of statistics first, just kind of give you an idea of what's been going on for some time. There's actually been a 22% increase in digital fraud since early March. So we really have to make sure that we do our own diligence in helping ourselves out. And I'm just going to go over a few things that we can do to help us, help us out, our friends and our family members, since we're going to be at home. So one of the things that we, can do is start more frequent security updates on your laptops and other devices at home. Ways in which you can do that is try changing your default passwords. Also, one of the big things is online shopping. If you're shopping for groceries, always know the company that you're dealing with. For smartphones, food, takeout apps like Grubhub, Uber Eats, etc. Always access them through trusted sources. For example, like Google Pay or Apple App Store. Scarcity is a lot going on with the scarcity, so we have a lot of predators kind of preying on that. Criminals will send phishing emails disguised as promotions for items hard to target. Like for instance, toilet paper was one of the things that a lot of people were kind of running around. It was scarce, so you'll see a lot of promotions for that. Hair clippers is another item. If you guys don't know now, is hair clippers are running out, so you might see a little bit of criminals fishing for items such as that. Hand sanitizers, believe it or not. Another thing that we have to watch out for is promotions. Promotions, do not click on items. Refrain from that. Instead, go to websites. Go to the websites, the specific company websites. If you are interested, check to see if, in fact, they are running that promotion. So, for instance, if it's a promotion that pops up on your laptop, you might want to go right to that company's website to see if they actually are running that particular promotion. Do business with companies that you normally do business with. If you never heard of that company, that have to, that's probably a company that's been put together from it's fraud. It's just fraud. Video conferences is very, very popular. It went from 10 million to about 200 million 200 million since the end of March. It's probably more than now with the video conferencing. Attackers register more than 1,700 Zoom-related domains worldwide. As you know, we all got attacked a couple of weeks ago from white supremacists. So there's a couple of things that you can do while signing up for Zoom, and one is to make them open, issue a meeting ID with a password. Do not pass links out on your websites. You can go use other ways to meet, like go to meeting. You can still use Skype. If you are having like meetings with your family, I would suggest that you do not discuss personal business, discuss money, banking information while on Zoom. Take serious precautions for that. Another thing is, while you're not on your laptop, it's very important that you cover up that lens on your laptop, because just because you're not engaged in anything like Zoom or anything like that, that doesn't mean that someone else can be looking in through your lens. That's something that they've been talking about even before COVID. It's very important. Telehealth calls. A lot of us now are getting appointments through telehealth calls. So many doctors and other medical personnel are using this as a vital tool. It is a valuable option for patients now. Doctors will not call you out of the blue. Don't take calls unless you set the appointment up. Frauds are very, very, very common. They're looking for personnel and personal information and sensitive information from individuals when they're going to phishing. Unless you initiate the call, do not give out the information. Call your doctor to confirm if you're unsure of these appointments. Another thing is a credit card or lines of credit via email or through the mail. A lot of times they're like working on your vulnerability. So you can see some things, for instance, that can send up a red flag. So for instance, if you're being offered a $5,000 or $10,000 line of credit with a low interest rate in 6 months, very seldom you're going to see something like that where you get a low interest rate over a course of 6 months. But people are falling for that trick. Another thing is the online classes. A lot of things that you can do, in particular with many of us that are doing online classes, or our children are working from home, homeschooling. 3 things that you can do is enable parental controls on all devices in the house, like TVs, laptops, gaming devices, tablets. Most routers have a content filter option to develop with a white list or a blacklist, and also cell phone check. Check your carrier. Many plans have a way in which you can limit the cell time with your children. And there's also a site that you can visit with a lot of information in terms of security. And the site is, you can put this out as well. It's EDUCAUSE, EDUCAUSES. It's called Edu Causes. Is a site that you can go on, and they have more updates as far as security on social media. And that's pretty much all I have. Thank you.
All right, thank you so much, Brother Maurice, for that update. It's definitely a lot of good information there. So we appreciate you just being so thorough and making sure that we're covered on all aspects. As you stated, a lot of our life right now is being conducted virtually. So I think that we definitely want to take the necessary precautions when we are engaging virtually, whether it be shopping or social interactions with family, that we are protecting ourselves and being mindful that there are predators out there that are looking to take advantage of the situation. So, Brother Maurice, thank you so much for that update. Sister Wawa, you can unmute your mic and give your update.
Hi, everybody. Good morning. Can you hear me?
Yep, we can hear you loud and clear.
All right, perfect. First of all, I just want to say grand rising, everybody listening. I do apologize for my absence last week. I did have a 4-hour online class prior to that, and a bit exhausted from different things and wasn't feeling that well. So shout out to Brother Maurice again. He contacted me in the morning just to make sure I was okay. And on that note, one of the things I wanted to talk about was simply just communication from a health and wellness standpoint, or from I guess mental health standpoint. Um, that during this time, we're finding a lot of people, just isolated from their friends and family, and it's very important to reach out to people, maybe make rounds, from your contact list, family, friends, neighbors, and just talking with people to stay connected and to show that you care, because we find that a lot of people are realizing the difficulty and struggle of what isolation can do, especially in our community and us as Black people. We've always been very social, and very much, if not physically, but just at least communicatively involved with everyone in our immediate community. So, on that note, just be mindful to check in on people, and see how people are doing, so that we can take care of each other in that regard. As far as communication with us as AI Philly, we have uh, updated opportunities for you to stay connected with us. So you can join us on our Slack channel, where we drop information and links and things like that are ongoing day to day. You can contact us at victory at aiphilly.org. That's victory at aiphilly.org. Definitely follow us and across all of our socials. We're on Facebook at AI Philadelphia, IG, Instagram at AI_Philly, Twitter at AI_Philly as well. However, we are still dealing with the technicality, and the folks at Twitter support just haven't really gotten back to us yet, as far as delays from COVID-19 or who knows what else. You can search us on YouTube to catch our podcast and other streams that we have across there by searching AI Philly on YouTube. You can also definitely follow us on a BB to Me, which is a Black owned and run social media and pretty much online universe. It's called a BB to Me. That's ABIBITUMI. You could search our group page at Afrocentricity International Philadelphia on there as well, and connect with a lot of people in the conscious community. Lastly, on connecting with us, definitely be sure that you subscribe to our listserv. That is where you'll receive a lot of your primary information as the public, from as far as what's happening with us. And to do that, you can definitely find it on our social media channels at this time, as we are still under construction for our website. So definitely look out for that in the future. And then in terms of communication for COVID-19 related information, I do want to just reiterate, I haven't mentioned it in a few weeks, but definitely go online, phila.gov/COVID-19, and there you're going to get links to a lot of different myriad of just practical things, like where you can go to get food, or what kind of different services are going on in the city. Obviously, the latest information and press briefings, which do happen weekdays at 1 p.m. You can also get text alerts. So definitely text COVID PHL to 888-777. And those are free for the community. It is good to just be aware and know of what the officials and the government are saying and reporting, whether or not, that's, consistent, reliable, up and down, in terms of how that affects us as Black people. But we should still be aware of what they are putting out there. There is a helpline as well if you would like to call, and that's if you have any questions about symptoms and risk, and maybe need some more direction if you're not able to go online. You can call that helpline. It's a 24/7 medical professional helpline, and that's at 800-722-7112. That's 800-722-7112. And then last, I just want to reiterate, obviously in Philadelphia, it's the, tri-state area. So if you do live across the bridge in Jersey, or if you live in Delaware, please go to your respective state government website. That would be nj.gov or de.gov to follow through some links for some similar information that I just enumerated there for Philadelphia. And that's all I have today, Brother Omwale.
Okay, thank you so much, Sister Wahida, for that communications update. Communications are definitely vitally important during this time. And it's important that our members know how to stay in communication with us throughout the duration of this particular crisis. So my update on programming, AI Philly, our crisis preparedness programming, we still have the elder care program that's ongoing. This is something that we started to respond to the crises, but I can definitely see this particular program continuing even after the COVID-19 crisis and things get back to somewhat of a new normal. We're having some success with this program. So through our partnership with North Philadelphia Peace Park, on a monthly basis, we are providing fresh produce care packages. So if you are an elder in the community, or you know an elder in the community, in our AI family and MKAI network, please let us know if they'd like to be added to the list to receive a care package from North Philly Peace Park. The Shop for an Elder program, we're still looking for elders who may need assistance with their grocery shopping to definitely let us know. If you'd like to volunteer to assist with the shopping, please do let us know. We're always looking for volunteers to assist in the city with shopping for our elder community. And last but not least, the African Family Fitness and Survival Training Handbook. We currently we've started accepting some submissions internally from our membership, but we have an update meeting scheduled for, I believe it's the 9th of April. I'm sorry, the 9th of May. Just want to check the date because it's a Friday. Okay, I'll confirm the date and we'll send it out in the calendar meeting because the 9th seems to be it. Oh, okay. No, I'm looking at the wrong month here. Okay, so it may be the 8th of May, but either way, I'll confirm the date for that meeting. And if you're interested in learning more about the African Family Fitness and Survival Training Handbook, as well as ways in which you can make a contribution, you can definitely join in for that particular call, because this will be something that we produce to provide to the community for free, just to make sure that we all have the basic information so that we can prepare adequately to meet any crises, whether it be a natural, whether it be biological, one like what we're facing today with COVID-19, financial, or any other crisis that our community may come up against, so that we can definitely be prepared and survive it. And that is basically it for the call today. We've given basically all of our updates. So what we'll do now is open up the line for anyone who has any questions. If you have any recommendations for preparedness workshops that AI Philly could potentially put on, for the moment it would be remotely, but when we open back up, we would love to host workshops in present. So yeah, if you have any questions, concerns, updates, now is the time to unmute your mic and you can ask your question or give your update. And after that, I'm going to ask our good brother Maurice just to close us out in prayer, and that will be our update call for today. Sister Wahida, I see your hand is raised. You can unmute yourself and ask your question.
I was kind of thinking about, this ongoing initiative we have with the African Family Fitness and Survival Training Handbook. And I was wondering, is there any, group or, set of people that are setting up like some sort of, I want to say, like meeting location action plan, like in case if there is any sort of serious situation where groups of people need to like meet at points, or is that something that we'll be considering to put in the handbook
I,
as AI Philly?
I think that we'll definitely, so the handbook will be informative. It won't necessarily be prescriptive, like to that level of
Hmm.
detail, but we'll definitely provide information to where people can learn more about how to develop, such like an exit plan in the event of a crisis. I think one thing
Right,
to
right.
keep in mind is that, that particular action plan has to be something that you put in place for you and your immediate family. I don't know if it's something that is feasible for larger organizations logistically to carry out, but definitely each member of the organization should be thinking about, their own personal, emergency evacuation plan in the event of a crisis, and definitely coordinating with their family members who they are responsible for, to make sure that they're involved in it. So,
Oh, absolutely. I don't know. I guess I was just thinking in terms of like, how do we bridge those families who have those action plans in place then together, on a next level? That's kind of where my head was at with that. But yeah, definitely look forward as we continue to work on the handbook.
okay, and I'm hoping, because I know that that particular area is something that you feel strongly about. So the outline for the handbook has already been developed, and that part has been added. So I'm hoping that you might be willing to actually be the one who takes responsibility for that particular contribution if you're interested.
Gotcha. I'm on
Uh,
it.
all right, cool, cool. All right, any other questions, updates, concerns? Now is the time. You can just unmute yourself and all right. If no one else has any other questions or concerns, Wahid, are you raising your hand again?
Yeah, yeah.
Okay.
Sister Kizzy, do you know during the rollout, whenever that's going to be for Philadelphia, in terms of like opening up the city, what kind of measures are being taken place to like, I guess this is a broader question as well. Like, how are they intending to protect, um, waves of people coming in and out from different areas in terms of different rollout phases and sort of threats from numbers between suburbs and urban areas and so forth like that? If that does my question make sense?
Sister Kizzy, your volume is very, very low. We're not really picking you up on the call.
Can you hear me now?
A little bit better, it's still somewhat suppressed, but it's a little better.
Okay, I'm just gonna be loud and in the mic. Is this okay?
It's not much better. Anyone else? Is it just me, or is Kizzy really faint?
Yeah, she was much more faint than from earlier.
How about
Yeah, you're really, really faint. Wahida, what was the question that you asked her again? Because I know she pointed us to some resources, in terms of where we can get the information. So maybe we can rendezvous with her after the call, and add that information to the update that we send out.
Sure.
All right. Thanks, Sister Kizzy. I don't know where you are, man. I don't know if they got good connections over there in North Korea, but you be safe out there. All right. So if we don't have any other questions, updates, or concerns, Brother Maurice, will you just do us the honor of just closing us out in prayer?
Yes, indeed. We want to thank the ancestors for allowing us to come together collectively with all the information that's needed for our people. We thank you, God. We thank you. We thank the ancestors also for allowing us to rise up this morning and be healthy and have the use of our limbs and our mind in a sound way. We thank you for all the individuals that did come and to listen to this, COVID update. And now, as we go on our day, we want to ask the ancestors to continue to guide us and ask the ancestors to continue to restore us in the way that we all need it. I pray the Creator bless the family members that are with under the sound of my voice. I pray that all of us stay safe and that we use our good wisdom and continue to practice social distancing during such a time as this. I also want to thank the ancestors for the opportunities that presents itself, that we grow during this time while we're inside, and always practice good, just love in general. Just continue to spread love and allow us to grow during this time until we're actually physically able to come out. Unity is our aim and victory is our destiny. Ashe.
All right. Thank you all for joining us. We'll see you again next week at 7 a.m. Peace.